Hey guys, it's Dr. Sam Robbins. Now I've gotten well over like 25 to 30 questions about varicocele lately, so I wanted to do a video about it today because it's more common than you think. Now it typically affects about 15% of adult males and around 20% of adolescent males and teenagers. And I'll even share with you my own personal story about this in a couple of minutes, something that I've only told about 3 or 4 people, so make sure you keep watching. Now, first, varicocele is basically scrotum varicose veins. It's an enlargement of the veins within the scrotum. So it's similar to regular varicose veins that you have typically seen on legs, for example. And at the end of today's video, I'll give you a link to another video specifically about treating varicose veins. Except that in varicocele can be a more serious problem because it can cause low sperm production, decrease sperm quality and mobility, and actually cause infertility. And it can also cause lowered testosterone levels due to the decrease in testicular size. In fact, varicocele is present in up to 45% of men with primary infertility and up to a whopping 80% of men who have secondary infertility. And as far as what causes varicocele, basically, blood just isn't moving through the veins like it should be, so there's a buildup of blood. Unfortunately, there is no real specific reason or cause for the varicocele. However, in a minute, I'll give you some options for preventing and fixing it. Now, as far as the symptoms, there may not be any associated with it directly, but you may feel swelling in your scrotum, maybe a lump in one of your testicles. You may see really also large veins or twisted veins in your scrotum. Some describe it like a bag of worms. And also a dull pain that's either reoccurring or just, it's consistent or it comes back and forth. So how do you diagnose it? At some point, some of you may even be touching your testicles and thinking, I think I may have varicocele. But how do you know for sure? Well, you have to go to your doctor and they can diagnose it. A general practitioner is fine, but basically a urologist is the ideal physician who you'd want to see, again, if possible, if you have access to one. They can diagnose it with a physical exam, or if they're not sure, they can do a scrotal ultrasound, will also give you a more definitive answer. Now, as far as treatments, you may not have to, especially if your sperm production is fine and you're not trying to get anybody pregnant. However, if you have discomfort, if you have pain, or your testicles have shrunk, then I think it would be a good idea, especially if you have lower testosterone levels as a cause of it. Now, as to how it should be treated or fixed, let me quickly share with you what happened to me. Now, this was a long, long time ago. I was in 5th grade, so I was about 10 years old, since I was younger than the other kids in the same grade. And I remember basically walking into class one day, sitting down, and slowly I started to feel pain in my testicles. And within the next hour, the pain was intensified greatly. I mean, I could hardly sit down because it was too painful. And I remember it was summertime because I was wearing shorts. And basically, the pain became so bad that I just got up, turned around, and walked out of class. I had to take these short little steps because it was in so much pain to walk. And I think the teacher even asked, Sammy, where are you going? But I was in so much pain that I was just zoned out. And I just started, I head home. I just started walking for home. I didn't even think about going to the nurse or telling anyone because, it was my testicles and I felt weird and I guess embarrassed. Now, luckily my home was about 3 to 4 blocks away from the school, not far, typically maybe a 10 to 15 minute walk, but not that day. I could barely walk. It took me like a freaking hour to get home, one small step at a time. And it was the hardest going up the hill. Now, when I got home, I immediately told my mom. Of course, she said, "Oh my God, let me see." I refused. And again, I was just embarrassed, right? I just said, "Please take me to the hospital." And of course, like any good mother, she freaks out. She gets her purse and we sped off to the hospital. And to make a long story short, the doctor had said that my veins in my scrotum had not only enlarged a lot, but they got tangled up. And that's what was causing me so much pain. And he said, basically, I have 2 options: to have surgery, which is option 1, which is what he recommended, or to ice my testicles for the next few days and just not move much and see what happens. Well, the last thing any young guy wants is a knife to his balls. So I opted for the ice. And the truth is, I don't even think we had any money to the hospital to do the surgery since we were just broke. So ice it was. I went home. I laid on the couch for the next week, just icing my testicles all day long, on and off, on and off, on and off. And luckily things healed and the swelling went down and the veins untangled and I was fixed and they were fixed. No surgery, and I got to stay home from school for a week. Luckily, I haven't had any issues since. And thus, the treatment in such severe cases like mine is typically surgery, especially if you're older, right? I was, getting only 10 years old. I guess I was lucky that the ice worked. Needless to say, surgery is the primary fix. However, as stated, surgery is only medically necessary if you are in pain or if you're trying to have a child and you have low sperm production due to the varicocele. So there you have it. You now know something about me that I've only shared with 3 or 4 people in my life. And also, before I end this video, make sure you view my other video entitled How to Prevent, Reduce, and Erase Varicose Veins. It does pertain to this as well. The direct YouTube video is linked below in the description area.